बिस्मिल्लाहिर्रहमानिर्रहीम, अस्सलामुअलैकुम। आप देख रहे हैं DTVNN। मैं हूं ताबिंदा गुल। आइए नज़र डालते हैं अब तक की खुसूसी रिपोर्ट पर। 6 दिसंबर को एथनिक मीडिया सर्विस ने एक कौमी ब्रीफिंग का इनेकाद किया, जहां माहिरीन ने मेडिकेटेड चिल्ड्रन हेल्थ इंश्योरेंस प्रोग्राम CHIP और सप्लीमेंटल न्यूट्रिशन असिस्टेंट प्रोग्राम SNAP के हवाले से मुमकिना बजट कटौतियों पर बात की, जो 85 मिलियन से जायद अमेरिकन को मदद देती है। माहिरीन, जिसमें जॉर्ज टाउन यूनिवर्सिटी की जॉन एल्कर और चिल्ड्रंस पार्टनरशिप की मायरा अल्वारेस शामिल थीं, इन अहम प्रोग्रामों पर मुमकिना खतरात के बारे में खबरदार किया, जहां खास तौर पर सदारती एम्पावरमेंट प्रोसेस के इस्तेमाल के हवाले से जो कांग्रेस की मंजूर शुदा फंड्स को रोक सकता है। ये ब्रीफिंग इस बात पर जोर देती है कि इस सियासी तब्दीली के दौरान कमज़ोर कम्युनिटीज़ के तहफ़्फ़ुज़ को यकीनी बनाया जाए। इस अहम मसले पर मज़ीद क्या कहा गया, आइए देखते हैं इस वीडियो में।
Good morning, everyone. Welcome to today's Ethnic Media Services News Conference. I'm Sunita Sarabji, Health Editor at Ethnic Media Services, and your moderator today. As President-elect Donald Trump prepares to take office, several federal health programs may face budget shortages as the new administration aims to reduce inflation and debt. These cuts are likely to take aim at Medicaid, the Children's Health Insurance Program, also known as CHIPS, and the Supplemental Nutrition Assistance Program, among other safety nets. These programs collectively serve over 85 million people in the US, including many of your readers and viewers, which is why this call is so important today. Speakers this week will discuss the impact of budget cuts to these critical health safety nets. They will also discuss the consequential impoundment process, which basically allows the president to simply stop the flow of funds to programs authorized by Congress. So we're honored to host an esteemed group of experts. They are some familiar faces: Joan Alker, Executive Director of the Center for Children and Families and Research Professor at the Georgetown McCourt School of Public Policy Foundation. Joan will discuss potential cuts to Medicaid. Myra Alvarez, President of the Children's Partnership. Myra will discuss potential cuts to the Children's Health Insurance Program, CHIPS, and SNAP. And Richard Kogan, Senior Fellow at the Center on Budget and Policy Priorities. Richard will discuss the impoundment process, which could be used by the president to simply withhold funds Congress has allocated, as I mentioned earlier. We are honored to have all three of you here today. We will take questions from reporters immediately after each speaker presents, and we will send videos along with follow-up collateral after today's briefing. So let's begin with Joan Alker. Reporters, please enter your questions in the chat, and welcome, Joan.
Thank you, Sunita, and very glad to be here with all of you today and to touch on this really important topic. So as I've been saying a lot recently, Medicaid was not a topic that came up during the presidential campaign. There was basically no mention of Medicaid by either presidential candidate, but it has been on the minds and spoken about many times since the election, and unfortunately in the context of potentially big cuts. So I'll come back to that, of course, but let me start by just giving a very important top line about what Medicaid is and what it does. So Medicaid is the program here in the United States that serves low-income people, low and moderate-income people, and also plugs some gaps in the Medicare program, which is the program that provides health insurance to primarily senior citizens. So Medicaid is performing many functions. I often call it the backbone of our healthcare system. It is the largest payer for long-term care. And so that is a very important piece of the program. It's a very costly piece of the program. And it's something that Medicare does not provide on a long-term basis. So Medicaid has to wrap around Medicare to provide long-term care for seniors and people with severe disabilities. Medicaid is also paying the cost sharing for low-income seniors for them to be able to access their Medicare benefit. So those are people we call the dual eligibles. Medicaid is also critical for the area that I work on a lot, along with Myra, which is children and families. Nearly half of all children in the United States are covered by Medicaid. And in terms of births, 40 to 50%, depending on where you live, are being covered by Medicaid. Medicaid is also one of the largest payers for behavioral health and substance abuse, both areas where we have many, many challenges facing our country right now. And Medicaid is also a critical payer in rural areas. In fact, Medicaid's role is often even greater in rural areas than urban ones. So Medicaid performs many functions. Now, the second important piece to how you think about Medicaid is that it is a federal state program, and the federal government is providing the majority of the funds, but states are actually running the program. So sometimes Medicaid has different names depending on where you live. So for example, in California, it's called Medi-Cal. But this program, the majority of the funding is coming from the federal government. And as such, Medicaid is the largest source of federal funds coming into state budgets. Medicaid accounts for about 56% of all federal money that is flowing to states is coming in through Medicaid. So if we do see big cuts to Medicaid, that will affect all areas of states' budget, not just their health budget. Now, during the campaign, President-elect Trump said that he would not make any cuts to Medicare. He would not make any cuts to Social Security, and he would not make any cuts to the defense budget. So if we take him at his word on that, what's next in federal spending? It's Medicaid. And that's why we know that Medicaid is a target for potentially very big cuts in this Congress. We know that Congress will try to move quickly to get done its business next year, and all eyes really need to be on what they're doing right out of the box in January. They do not have to wait for the president to be inaugurated. They can move a budget resolution as quickly as they can manage in January. And the committees will have to fill in all the details. But if there is a large number assigned to cuts for health, we know that Medicaid will end up being a very big portion of those cuts. And so it's really critical to keep an eye on and educate folks about how this may happen quickly, and cuts to Medicaid would be very severe. So let me just talk about the kind of buckets of the kinds of implications if we see large cuts to Medicaid. Medicaid, as I mentioned, would create serious problems for state governments who would not be able to fill in the gap. If Congress were to make any fundamental changes to Medicaid's financing structure where the federal contribution was capped, or substantial cuts were made in the federal matching rate, it would be near impossible for even a well-intentioned state to make up these cuts. And particularly when you think about, we have an aging population, and this is already where the majority of Medicaid funding goes. Children are the largest group, but they don't cost that much. We have an aging population, and these cuts will be backloaded. so that the current folks in office don't have to take so much of the blame. So that will set up a very, very untenable situation for state government. States will be given new tools to...
Joan, I'm so sorry. Could you explain that a little bit more? You said the cuts will be backloaded. And I wonder if you could just explain that a little bit.
Sure. And Richard is, budget expert extraordinaire. So I hate to even go near his turf. But these cuts will probably be playing out over a 10-year period and may accelerate over that 10-year period or even longer if there are changes to the financing structure. But Congress is usually very good at thinking about ways to structure these kinds of cuts to so that the pain is not immediately felt. But maybe Richard can comment on that too. So states will be given, in the event of cuts, they'll be given new quote unquote flexibilities, which means theoretically that these new flexibilities will help them adjust to the cuts. That will be the argument. But in practice, these flexibilities will mean things like cutting back eligibility, adding red tape so that it's harder for families and people to get through the process, which cuts down on enrollment. And we know that from the unwinding that we've just been through. Benefits could be limited. Providers who see a lot of low-wage workers, providers in rural communities, or those who are seeing a lot of low-wage working families could very likely face cuts in their reimbursement. That will be very hard for them to absorb. So all of these different groups, children, seniors, people with disabilities, low-wage workers, will be put at risk if we see substantial cuts to Medicaid. But the last thing I just want to say, to end on a more positive note, is that Medicaid is very popular with the voters. And I think that's why we didn't hear about any plans to enact big cuts during the presidential election. Medicaid tends to pull right behind Medicare, which is one of the most popular programs that we have in this country. And voters, I believe, don't want to see big cuts to Medicaid. This election was about cost concerns that families have, and they certainly don't want to be paying more healthcare costs. So that's why your job is so important, to make communities aware of what Congress is considering. And with that, I'll hand it back to Sunita.
Joan, we already have a number of questions for you in the chat and questions that came in via email. So I will start with the questions that are in the chat. Nora Estrada, could you please ask your question and identify your news organization?
And good morning, Nora Estrada from �KIOSCO News. How many Latinos will be affected for Medicare?
That's a great question. And Nora, could I ask you if we could take it a little bit further? Joan, do you have demographic data on Latinos, Blacks, and other minority populations that would be affected by cuts?
Yes. Thank you for asking that question. I meant to actually bring this up in my remarks. People of color are disproportionately enrolled in Medicaid for their health insurance. And the numbers are kind of bouncing around a lot right now because of the unwinding, but some good data that we have from KFF, which is a great source, is that for non-elderly adults, so people under 65, 34% of people identifying as Latino are covered by Medicaid, 34% of all children and adults. For Black people, 39% are covered by Medicaid. For the Native Hawaiian Pacific Islander population, 35% are covered by Medicaid. And the percentage is also quite high for American Indian Alaska Native population. It's even higher. I can look that up. So this is disproportionately important. So it's 1/3 or more of many of these groups.
Wow, that is significant. Henrietta Burrows, you have the next question.
Thanks so much, Sunita. The president says he wants to make America great again. So wouldn't cuts like this bring about national protests, economic disruptions, more homelessness, increases in the poverty rolls, more people on the streets with drug problems? Or is it that the people affected, they feel don't have a voice?
Good question.
I don't know, Myra, maybe you want to jump on that one too. I think they've been trying to keep these cuts quiet because they know they're not popular. And as I just mentioned, Medicaid does pull very well with voters of all political parties, frankly. So, and I think it would cause significant economic disruption. The question, as I mentioned, is, when do they actually go into effect? How are they structured? There are lots of unknowns here.
Myra, do you want to comment as well?
I completely agree with what Joan was saying. I also think the way these cuts will move forward and how they'll be proposed, what they're packaged with, and the story that the administration will try to tell is something that this community of reporters, we will depend a lot on you to tell the story accurately. So there'll be a lot of work ahead to make sure that the American people know what's happening.
Absolutely. There's a question that came in via email. Could you explain the trigger laws which 9 states have that would immediately end Medicaid for more than 3 million people?
Yeah, sure can. And we have a blog on this very topic. And I think my colleague Yuli is on, so maybe she can pop that in the chat that my colleague Adam Searing just wrote. So there are between 9 and 12 states who, when they decided to adopt the Affordable Care Act's Medicaid expansion for adults below 138% of poverty, included in the state law was a provision that we call it a trigger provision. And what the provision says is if the federal match rate, right now, the federal match rate for Medicaid expansion is a very generous 90 cents on the dollar. So states are putting up 10 cents and the federal government's putting up 90 cents. And the laws differ a little bit, and Adam explains all of the different variations in the law and has all the references to the state statutes. So you can look up to see if your state is one of these states. But there are 9 states who have an automatic provision that if that federal matching rate goes down, that expansion ends.
Wow.
It goes away. And then the 3 states that get us up to 12 triggers a provision that the state legislature has to review in some way the authorization for that expansion. So depending on how you think about it, and of course, if they drop down the match from 90%, let's say, to the regular match, which in California is 50 cents, that's a huge, huge amount of money for California to make up. So I would certainly let Myra speak to this, but we would anticipate that over time, even states that don't have a trigger law would have to reconsider this expansion. But yes, depending on what you assume about, what those other 3 states would do, we would have 3 to 4 million people who would lose coverage immediately because of these state statutes.
Thank you. And I have one question before we move on to Myra. California has extended its version of Medicaid to undocumented residents in the state. Can the state continue if federal funding is cut?
I think, Myra, that's probably a question for you to address.
All
Sure,
right, Myra, then.
Yeah, I can address that. So first and foremost, the coverage of undocumented immigrants in Medi-Cal is paid for by state funds. So it's important to know that right now federal dollars are not covering the full scope Medi-Cal coverage for undocumented Californians. There are other components of the Medi-Cal program that is emergency Medi-Cal, that is part of federal law, but for the California expansion for full scope coverage, those are state dollars. I don't want to say that it will have no implications because a third of California's entire budget is reliant on federal dollars. So there is risk when federal funding are reduced for California, that California policymakers with input from the people, from advocates, will have to consider what does that picture look like moving forward. And that's part of the calculation and the risk that we're undertaking as we move forward into this next phase of the Trump administration. So I don't want to say one way or another that absolutely not, but it's something that we are all fearful of given the potential reduction in resources from the federal level.
Thank you. Joan, thank you. And will you please stick around for a final round of questions? Thank you. We move on to Mayra Alvarez, who will discuss the implications for children if budget cuts do come into effect. Welcome, Mayra.
Thank you so much, Sunita. And good morning, everyone. Thank you for the opportunity to be here with you. Again, my name is Mayra Alvarez, and I'm the president of the Children's Partnership. I want to give special thanks to EMS for holding this conversation and to each of you for the work that you do to inform our communities and their families about these policy changes or potential policy changes and the impact. For those of you that know the Children's Partnership, you know that we believe every child has a right to a healthy life, a strong, stable family, and a safe, welcoming community. It is because of those values and those commitments that we cannot understate the significance of what is to come at the federal level with a second Trump administration. In the United States, over 72.5 million children live here and are trying to live healthy lives. More than 5 million children live with at least one undocumented parent. In our own state of California, we're home to 9 million children. 3 out of 4 of those children are children of color, and 4.5 million children in California have at least one immigrant parent. Of those, 97% are US citizens. As we together consider what all children need to grow up healthy and thrive, I want to build on the comments that Joan began with and build on the fact that children absolutely need healthcare services and the security that coverage like Medicaid or Medi-Cal in California provides, but they also require a safety net and access to services that includes nutrition, economic supports, and more. And what we know thus far is that many of the proposals President-elect Trump and his team of advisors have made during the campaign, that those are proposals that could cause harm to the health and well-being of our children and their families. They've already put forward an agenda through Project 2025, through Republican budget plans, and again, through these campaign proposals that would increase poverty and truly diminish opportunity for children and families. In addition to the changes that Joan discussed around Medicaid, CHIP, and the Affordable Care Act, other changes that we're particularly concerned about include those to supports and services that help families meet basic needs. For example, one huge area of concern is the access to nutrition supports and services through SNAP, or the Supplemental Nutrition Assistance Program. Project 2025 makes policy recommendations that target this program and that makes it harder for people to access benefits while also creating more inefficiencies. Everything from increasing time limits for the program for adults without dependents, also eliminating categorical eligibility, which would remove the state options of increasing the gross income limit from 130% of the poverty line to up to 200%. And increasing or eliminating the resource test. Again, these are changes that hurt our most vulnerable and make it harder for people to put food on the table at a time when grocery prices have increased 24% between 2020 and 2023, and when we know wages have not increased proportionately. Additionally, the Trump administration will potentially seek to create a national standardized utility allowance for households with low incomes, which ignores this diverse utility usage across each state and would cut over $4.5 billion from SNAP benefits over 5 years. SNAP, or food stamps, as many people refer to it, it's our nation's first line of defense against hunger. It provides more than 40 million people with the financial assistance they need to put food on the table every month. Without adequate access to food, stress, poor health outcomes, and increased debt are likely to occur, especially considering how it's 78% of us in our communities are living paycheck to paycheck. Over the past 60 years, we've seen children do better in school when their families receive SNAP benefits. Giving them food today helps ensure that they have a better tomorrow, again, for millions of our nation's young children and children overall. Additionally, SNAP means that when older adults need to take their medicine with a meal, they're able to do that. They're able to have both the medicine and their food. SNAP also contributes to our economy, with each SNAP dollar generating $1.54 in economic activity. And I want to emphasize that despite those many strengths.
Sorry, Myra, could you explain that point, the economic impact of SNAP?
Sure, absolutely. So recognizing that the investment in public programs actually gives us more of an economic return. When people have food, are able to fulfill themselves, have that nutrition, they're able to go to their jobs. They're able to contribute to their economies. They're able to contribute to their communities. That is a direct return on investment that economists have demonstrated actually returns more to us than what we invest in the very program. Again, for every SNAP dollar, we get $1.54 in return. And what we know is that the incoming administration is seeking to make those changes to SNAP that will hurt millions of people. Additionally, they seek to end the Low-Income Home Energy Assistance Program, or LIHEAP. That helps families afford heating and cooling. There's been concerns that they'll put limitations on WIC funding. WIC is the Women, Infants, and Children program that provides essential nutritional supports to pregnant women and young children. We know that reductions in WIC lead to health complications for some of our most marginalized communities. There's also been a commitment to restructuring TANF, or the Temporary Assistance for Needy Families, which provides financial assistance to families. These are core programs that, again, help Americans from every walk of life raise their children and live their healthy life. They're essential to helping families, again, of all backgrounds, of all communities, of all rural and urban areas, raise healthy children, and we know they work. Like Joan said, these programs have strong public support. A consumer food insight study from Purdue University found that 1 in 2 conservatives support permanently expanding SNAP benefits. And public opinion shows 57% of voters overall support lifting SNAP time limits. The Food Research and Action Center, an organization on which I sit on the board, it found that 63% of voters nationwide are supporting offering free meals to students. It's these public programs that are core to helping families, again, meet the day-to-day needs of raising healthy kids. These have been bipartisan programs that have helped our families thrive. And before I close, I just want to take my last couple of minutes to really build on Sandy's opening comments. That's something that touches on everything we'll talk about today. And that's the anti-immigrant rhetoric that was centered throughout the next president's campaign. From racist rhetoric to harmful declarations of mass deportations, this is going to harm us into the future, and we expect this to be a huge priority. During his first term as president, we saw a dramatic chilling effect as a result of that narrative and those policies and those commitments from the Trump administration. What that meant was that people were afraid to access public benefits, even when they were allowed to, even when they were eligible for them. This means that immigrants may now not want to apply for the programs that they're eligible for or renew their eligibility, again, for fear of public charge, for fear of any other unknown question that they have. So we expect that there will be attempts to undo President Biden's progress on something like the public charge regulation. And I want to make clear that the fact that President Biden's public charge policy got all the way through the rulemaking process, survived multiple lawsuits, means it's going to be harder for Trump to reverse. And even if he tries, we're going to have months of notice because that's required by the law. I know that these questions coming up in our communities, and we want to talk about that as we think through. So as advocates for children, as advocates for families, we're going to know that we're going to work together, work collaboratively to educate communities, to push back against these detrimental cuts, and to do all we can to protect our children today and into the future. Thank you for the opportunity to join you.
Myra, thank you so much. There are several questions for you. Let's actually start with a question Sandy Close sent. Is Medicaid, if Medicaid is cut, what kind of healthcare would people with no insurance have, whether they're here legally or not?
I can start, and then I'll invite Joan to join as well. So I think it's important that we recognize that the proposals on the table look different, right? Whether it's cutting Medicaid dollars or giving states the option to operate it differently, which will lead to significant cuts or different changes in benefits. We do continue to have an important safety net and the availability of community health centers in our community. Community health centers are a lifeline for many of our communities in providing healthcare services in language, in a culturally competent manner, and hopefully will continue to exist. They have long been a bipartisan investment at the national level and at the state level, but there are questions about how will that continue and if it will continue, particularly recognizing the diverse communities that community health centers support. But we will continue to advocate for ensuring that we have a strong safety net of services to access the care and coverage that families need. And I'll hand it to Joan to talk in more depth about Medicaid cuts specifically.
Yeah, thank you. So there's not a good answer to that question because we don't know exactly how these cuts would happen, what the proposals would be. Would they put certain groups more at risk of becoming uninsured? Or would they lead states to cut back benefits, create waiting lists? But one thing is for sure, and I think this speaks to what Myra was saying, cuts in Medicaid lead to cuts for safety net providers. And so that's community health centers, safety net hospitals, will see challenges. And ultimately, at the end of the day, when people are uninsured, they aren't getting as much care as they need. And oftentimes they're incurring medical debt. And we know that medical costs are one of the leading causes of bankruptcy and debt. So that all of those problems just get worse.
Thank you. Thank you. There's another question, I think for both of you. Project 2025 recommends work requirements for accessing Medicaid. How practically would that work? And do you expect Trump to take on this Project 2025 proposal? Joan, if you want to start.
Yeah, sure. I can speak to that. So Project 2025 recommends many things. That's one of them. Project 2025 has proposals to block grant or cap Medicaid, which is the most catastrophic thing that could happen. So if that were to happen, work requirements are small potatoes compared to that. But having said that, yes, I think we're clearly going to see the issue of work requirements. It may come up in Congress. It may come up in the executive branch doing waivers. But if Congress changes the statute and allows states to do it, or indeed requires states to do it, there's no need for Medicaid waivers anymore. So that's one important point. I can tell you I do a lot of work on this issue, and we have one state in the country now that has a Medicaid work requirement, Georgia, and it has been a disaster. I'm hoping Yulia can also pop into the chat my most recent blog about Georgia. Almost nobody has gotten coverage there through this expansion, about 5,000 people in the entire state. And you can compare that to more than 550,000 in North Carolina that did regular Medicaid expansion. So it prevents people from getting coverage. And here's the kicker that we've seen in Georgia. It has been a complete boondoggle for consultants and lawyers because it's been in litigation. And Deloitte, which is an international consulting firm, has gotten 90% of the money spent setting up new IT systems. And that doesn't even include Deloitte just got a new $10 million contract to do outreach because nobody's in this program. So not only does it not provide healthcare to people, it's been a boondoggle with taxpayer dollars going to consultants and lawyers. So my blog explains that some more. So this is where we can look right now for actual real life experience with a Medicaid work requirement, and that's the state of Georgia.
Thank you. Henrietta Burrows and Araceli Martinez have questions, but I have a question for Myra before we go to them. Do you expect to see cuts in the federal school lunch program as well?
As I think, similar to Joan's comments, there are a lot of concerning changes and cuts to programs that support basic needs, including school lunch programs, including, again, food stamp programs, WIC, as part of Project 2025. Has there been a specific proposal put on the table? Not yet, but this is part of what we're exploring. These are programs that are not technically part of the education curriculum, right? That we know every school provides, but what we have seen is that schools are community centers for children and their families. They're a place where students go for educational enrichment, social connection, emotional supports, and because of that, they've been invested in and have grown in their impact and reach. They're tremendous partners in ensuring children can reach their full potential. So everything is on the table, Sunita. And again, I think we want to think carefully and watch carefully what's happening and really consider what those cuts mean and how we can push back against them.
Thank you. Araceli Martinez of La Opinion, could you please ask your question?
Thank you, Sunita. Hello to everybody. I was wondering what can we do? What can our government and legislators can do in order to protect us from these potential damages cuts? I knew that the governor announced 1% of our budget for a kind of legal defense, but I don't know if I don't see nothing about specifically about this, or maybe it can be some for health, for protecting our health. But what can we do?
That's a great question, Araceli. I can start by saying one of the areas that we will continue to push for resources is around outreach and education and ensuring families are aware of the supports and services available to them in their community, and also to ensure they have access to the correct information. Again, there will be a lot of misinformation out there, a lot of scary rhetoric and narratives that are not always productive and supportive of families' access to services. So outreach and education dollars that are allocated to trusted community resources, trusted community partners will be particularly important in the area of healthcare and social services. We also recognize that it's particularly important to continue to support the importance of creating safe spaces for children and families. So supporting schools as safe spaces, child care centers, our other community centers that families can know that they are welcome and that they can receive the supports that they need. That is going to push back against the anti-immigrant rhetoric, for example, but also the anti-government, anti-government program rhetoric that we know will be heard. So how can we ensure our families have access to these safe and welcoming communities? We have to make investments in that. And so earlier this week, the Attorney General issued a report on his commitment here in California, on his commitment to ensuring access to safe and welcoming communities in a state like California. And we'll continue to push that forward as we head into the next federal administration.
Thank you. And Henrietta Burrows has a similar question. Henrietta?
Thanks, Sunita. We know that Elon Musk will be holding or are heading up a committee to look into how to make cuts in the federal government, supposedly to make it more efficient. So should there be some targeting that would be done in terms of lobbying efforts, lobbying our representatives, perhaps focusing on Elon Musk's group to try to get to them to explain why these programs are so important?
I'm
Oh, Joe.
hoping Richard can address this. I think the place to keep your eye on really is Congress. But then there's the question of what the executive branch can do on their own through impoundment, which is something that the DOJ group is looking at. But I think Richard can really speak to that, and I'm not sure ahead of time how one can influence that. I think there'll definitely be litigation once it happens. But anyway, I'm hoping Richard can speak to some of that.
Richard, will you please speak to that before you present your remarks?
Yes, briefly. I know more than I wish I did about impoundment, including what's legal and what's not legal. And most of what I hear would be not legal. So the question is, and I can't answer this question at all, whether the administration will try to do things that violate the law, or whether they'll try to use the law correctly but to their advantage. In my discussion, I'll explain what that means. But my quick answer is, I don't know. And I imagine that half the people talking publicly about this have no idea what they mean, much less what they think is legal.
Interesting. So we welcome you now, Richard, for your formal remarks.
Well, thank you very much, Sunita. You've asked me to come and talk about impoundment. I've been thinking about impoundment on and off for half a century. That's because my first job in Washington was at the Congressional Research Service in the Library of Congress. The world's expert on impoundment and on congressional executive relations hired me in January 1973 to help follow the unprecedented and expansive impoundments that President Nixon was making, and to keep track of the many court cases on impoundments, basically all of which Nixon lost. This is not my favorite subject. I'm really a good number cruncher, but boy, am I steeped in impoundment. So, what is this impoundment brouhaha all about? Well, in the last 6 months, there's been a lot of talk about whether a president can impound, that is, refuse to spend, money appropriated by Congress for some program or purpose if he wants to use less or none of it. Some people who might be in the Trump administration claim that presidents have an inherent right to impound funds, that appropriations funding is optional, even asserting that the Impoundment Control Act of 1974 is unconstitutional. This and much of the public discussion is very confused or often just plain wrong. The key takeaway is that presidents have never had the general authority to impound funding enacted into law by Congress, and Congress couldn't even grant such authority to the president if it wanted to. Funding laws are laws, and the president must follow them. So here's the story. First, the U.S. Constitution does not grant the president the right to impound funds, just the opposite. It says that Congress decides what to spend money on and how much, and that the president's job is to, quote, take care that the laws be faithfully executed, unquote. When President Nixon nonetheless impounded a wide variety of appropriations that Congress had enacted and he had signed, and in one case impounded an appropriation that Congress had enacted over his veto, those who were supposed to receive the impounded funds sued, and Nixon lost every case decided on the merits, including one that went to the Supreme Court where he lost 9-0. In that case, funding for the Clean Water Act had provided $5 billion to be distributed to towns and cities in 1973 to help build and maintain municipal sewers. But Nixon impounded $3 billion of the $5 billion. The Supreme Court said that the Clean Water Act did not allow that. Importantly, every one of Nixon's impoundments occurred before the Impoundment Control Act of 1974 was enacted into law. He lost because courts said, case by case, that in this instance or that instance or another instance, the law designing and authorizing the program in question and the law appropriating money for those programs did not grant the president the power to say no. So it was not that the Impoundment Control Act made impoundment illegal. It always was illegal. It always had been. Second, in 1996, Congress enacted a new law, the Line Item Veto Act, which tried to grant presidents the power to make selective vetoes of so-called line items within future individual bills, mostly appropriations bills. Any such line item veto, any such impoundment, would go into effect unless Congress wrote a new law to forbid it. That is, Congress tried to give presidents some impoundment power that presidents did not otherwise have, and the Supreme Court ruled 6-3 that the Line Item Veto Act was unconstitutional. Congress couldn't give presidents the general authority to impound, even if it wanted to. So why do we need the Impoundment Control Act of 1974? What does it do? Well, there are three good reasons. First, the act granted the president new power that he didn't have to temporarily withhold funding for 45 days if he officially requested Congress to reconsider and reduce any specific funding for a specific program. The idea was to give time for Congress to amend an appropriation law to reduce or eliminate, that is, rescind, some of the funding it had provided. Second, the act changed the Senate rules so that the Senate could consider the president's rescission request on a fast track, no filibuster, so the money would indeed be rescinded if a majority of the House and Senate voted to do so. Finally, the act empowered the Government Accountability Office, GAO, to trigger the 45-day period if it found that funding was being withheld but the president had failed to report that fact to Congress. And it granted GAO the power to sue in federal court to get the impounded funds released if the 45 days elapse but the president fails to release the funds. So the best way to think of the Impoundment Control Act is that it regularized the process, establishing procedures that both the president and Congress had to follow. The president got the right to withhold funding temporarily and got rid of the Senate filibuster when it considered a request to rescind funding. Congress got GAO on its side to search out hidden impoundments and to sue for the release of funds if Congress didn't choose to rescind them, but the president nevertheless failed to release them. So what's my bottom line? 1, there is no general authority for a president to impound, refuse to use appropriations made by Congress, and there never has been. This is clear and settled law based on the U.S. Constitution. People who say otherwise, I think, don't know what they're talking about. There is a workable procedure for the president to ask Congress to reduce or eliminate some funding it had previously enacted into law, and to make it easier for Congress to agree. But that procedure also requires the president to be clear and public in every case, and gives the Government Accountability Office the right to make sure the president follows the rules. To be sure, every year Congress writes new funding laws and can amend other more permanent funding and tax laws. Joan talked about potential congressional amendments to the Medicaid law. I worry about them. I worry about the types of cuts that Congress might make, taking away or reducing health care, food assistance, education aid, or housing support for some or tens of millions of people. But it is Congress's job to write the budget laws and the president's job to faithfully follow those budget laws. They are not optional. Finally, a separate question is whether a president can interfere with the use of funding provided by law in ways that arguably fall just short of being an impoundment. Here, we'll have to wait and see.
Richard, fantastic. That explains a very important and consequential procedure that I'm sure a number of us had no idea about. So we very much appreciate your insights. We have some questions for you, and then I have a question for you as well. We go to Elena Kuzetsnova of Slavic SAC. Elena, please ask your question.
Okay.
There you are.
Here I am. Thank you, Sunita, so much. I have a couple of questions. The first question refers to Ukraine. So as you know, Trump denied funds going to Ukraine, which Congress already allocated. So what do you think going to happen to those funds? Will he really impound the funds dedicated to Ukraine? It's first question. And the second question is, it's about COVID-related COVID relief programs. Trump, I read somewhere that Trump wants to recall the funds already distributed among the Americans, and those are billions. And do you think it's gonna work? Do you think it's gonna happen? And if yes, how? Thank you so much.
So those are good questions. Let me take them in part. Back in the previous Trump administration, when Trump impounded funds that had been appropriated for that year to go to Ukraine, where I might add my grandmother was born, he did not tell Congress about that. He did not follow the Impoundment Control Act. He did it for purely political reasons, trying to get Ukraine to publicly say bad things about Biden. When it started leaking out that the funds weren't going out, Congress asked GAO, some people in Congress asked GAO to look into it. They found that he was doing it. They reported it, as the Impoundment Control Act says. That started the 45-day period. Trump refused to release the funds. Congress got pretty upset about this, and the House of Representatives passed an impeachment on it to remove the president for clearly breaking the law that the appropriations law that it had written. The Senate did not have enough votes to convict Trump of the impeachment, so he remained president. My memory is that those few Republicans in the House and the Senate who agreed and voted for conviction are no longer in public office. The Republican Party doesn't seem to like this. The question is, will he do it again? I have no idea. I have no idea whether this emboldens him to say, hey, I got away with it once, or whether you say, oh my God, what a mess once. And the last thing I want to do is to have GAO ruling again that I am breaking the law. You know, I don't know. We have to wait and see. And that, I might add, is the wait and see is the way I ended my original prepared remarks. I know what the laws say. I don't know what various people will do. You asked about COVID funds that have already been distributed. That money has been spent. It's not even an impoundment question. It has gone out the door. So it's one thing to say about money that hasn't yet gone out the door. I'm going to withhold this under the Impoundment Control Act for 45 days, request Congress to change its mind and rescind some or all of that funding. That would all be legal and follow the existing process. But money that has already gone to states and people is not the U.S. government's money anymore. So that can't happen. There's very little COVID money left that was that was created specifically as COVID money, but hasn't yet gone out the door. Among other things, most of the money that was in that category was rescinded as part of the so-called Fiscal Responsibility Act of 2023. That was the law that also suspended the debt limit until January 1st of 2025. So does that answer your question?
Elena, does that answer your question? I think so. We are going to go to our 37-second sound bites from each speaker. Joan, let's start with you. What would you like to reporters to take away from your remarks?
I would say keep your eye on what Congress is doing, and feel free to join our mailing list, our website. We'll put in the chat. We will be keeping folks apprised, blogging, also on X. I can put my, and Blue Sky, I'm on there. And the Center on Budget and Policy Priorities, Richard's organization, is a fantastic way to keep abreast. But this could happen quickly, and I really encourage you to stay very engaged and focused on what this means for your communities.
Thank you, Joan. Myra.
Thanks so much for the work that you do to educate our communities. As a child advocate, I'm here to emphasize to you to consider the particular implications on a child's well-being. Many of the policies that come forward may not have a specific child focus or child title, but they have important implications on the health and well-being of children. And what we want to make sure we're paying attention to that. Every child deserves the right to a healthy life, a strong, stable family, and a safe, welcoming community. And it's up to us to really protect our country's social safety net in order to make that available to them. We'll be paying attention as well, working alongside Joan and Richard and many others. So please follow the Children's Partnership at Kids Partnership on all of the channels, and look forward to continuing to work together during these next few years and beyond.
Thank you, Myra. I'm so sorry. Richard, final comments.
You'll forgive me for repeating myself. My bottom line is that I want all of you to know that there is no general authority for a president to impound appropriations made by Congress. There never has been. This is clear and settled law, and the Constitution is it's based on the U.S. Constitution. There is a workable procedure for a president to request Congress to change its mind about previous appropriations and reduce them or eliminate some of them. And it's unclear whether a new administration would use that aggressively. It has not been used aggressively in the past. They could use it aggressively, and then if the votes are there in the House and the Senate to change your mind and reduce funding, that's all legal. It may or may not be good public policy, but at least that's all legal. And I'll stop there because the rest of the inference is obvious.
Absolutely. To all our speakers, thank you so much for joining us today. This was really insightful, and I think you hit upon many of the things that I don't think we quite understand yet. So very much appreciated. And reporters, we will see you again next Friday. Take care. Bye-bye.
ये थी अब तक की खुसूसी रिपोर्ट। मिलते हैं अगले बुलेटिन में कुछ मजीद खबरों के साथ। देखते रहिए देसी टीवी USA, DTVNN, हमारा OTT प्लेटफॉर्म DTV Flix, जहां आप 3000 से ज़ायद चैनल्स देख सकते हैं। सो स्टे ट्यून एंड स्टे विद अस।